Today's topic is about systemic sclerosis. I'm Nelson Tobias, a KCMU medical student. Systemic sclerosis is a multi-system disorder characterized by inflammatory, vascular, and sclerotic changes of the skin and the various internal organs, especially the lungs, heart, gut, and kidneys. Scleroderma is an old terminology. It means sclerotic or hard skin. So, systemic sclerosis was previously known as scleroderma. When there is no systemic involvement of the disease, it is called morphia. Prevalence is 20 per a million of US citizens. This is a US data, mostly seen in American natives. Oklahoma City, and the age of onset is between the age of 30 to 50 years, and it's seen more in females than males, the female reproductive age. Systemic sclerosis is classified into two major subtypes. There is a limited cutaneous systemic sclerosis and diffuse cutaneous limited systemic sclerosis. The limited cutaneous systemic sclerosis, this is the most common one in 60% of the patients. Slow in onset and usually female. Long history of Raynaud phenomenon. We are going to see what is Raynaud phenomenon in the next slides. Skin involvement is limited to hands, feet, face, and forearms, and that is called atherosclerosis. High incidence of anti-centromere antibodies and Cresty syndrome and systemic involvement might not appear for years. Patient usually dies of other causes. The diffuse cutaneous systemic sclerosis, this is as a rapid onset and diffuse involvement of the hands, feet, trunk, and face. The joints are also involved and internal organs such as the heart, lungs, gut, and kidneys. The anti-centromere antibodies are uncommon here. The anti-topoisomerase 1 antibodies are present in 33% of the cases. Known antigen or autoantibodies stimulating lymphocytes to release interleukin 13 and tissue growth factor B. So these cytokines causes increased production of collagen, fibronectin, and extracellular matrix protein, such as the GAGs. What do they do? They cause a systemic inflammation due to interstitial and the perivascular collagen deposition in various parts of the body, including the skin, the gut, the lungs, and the kidneys. And they cause the fibrosis and the sclerosis. That's why it becomes the skin becomes hard, and that's why it's called systemic sclerosis or scleroderma. So there is also microvascular damage which leads to ischemia and skin ulceration. Clinical presentation includes different parts of the body, starting on the skin of hands and feet. There is Raynaud phenomenon. This is a triphasic color change due to hypoperfusion of the hands or feet. What is seen is pallor, which is white, cyanosis appears as bluish, and the rubor appears as reddish discoloration, like the France flag. So there is also an unrepeating edema of hands and feet. There's a rat bite necrosis, it is a painful ulceration at fingertips and the sclerodactyl, hardening of the digits. Claw-like hands and the carpal tunnel syndrome due to damaging or compression of the median nerve. So this is how the Raynaud phenomenon appears. As you can see at the tips of the fingers, there is a bluish color, which means there is the cyanosis. Here there is a white color, pallor, and here is telangiectasia, redness, rubor. This picture also shows scleroderma, atherosclerosis. You can see that the fingertips, they become pointed, tapered because of ischemia. They are dying, they're becoming hard, and because the skin is hard, you can see a shiny skin. This picture also shows the Raynaud phenomenon of the digits. You can see here starting to look bluish. This already is gangrenous. We are continuing with the clinical presentation. Now at the face, you see a mask-like face, microstomia, which means a small mouth, radioperiodal furrowing, and beak-like sharp nose. Distribution is early on fingers, hands, and face. Later on, it appears on the distal upper and the lower extremities in limited cutaneous systemic sclerosis. Now, Christie syndrome is a combination of five things. This one is calcinosis cutis, which means deposition of calcium, renal phenomenon, esophageal dysfunction, scleroductal and telangiectasia, dilatation of arteries. Now, this is how the mask-like faces looks like. This woman is old, but she looks younger because of the disease. Eh? The face is shiny, which means it is hard. There is a loss of the normal facial lines. Microstomia, small mouth, and a pointy nose. This also is a microstomia and perioral furrowing. You can see the lines, perioral furrowing. This one also shows the Cresty syndrome. You can see telangiectasia. These ones, dilated arteries. Yes. So diagnosis is by history and the physical examination. Renal phenomenon, which should be observable. Cresty syndrome and the systemic examination. Systems: cardiovascular, respiratory, gastrointestinal system, and the genitourinary system. Differential diagnoses include eosinophilic fasciitis, scleromyxedema, porphyria cutanea tarda, chronic graft versus host disease, PVC exposure, and adverse drug reaction. So investigation includes laboratory and the imaging. You can do laboratory investigations such as dermatopathology. Here, skin biopsy is taken, and you observe endothelial cells in dummies. Later, collagen deposits, and the epidermis is usually atrophic because of the deposition of collagen in the dermis. You can also do ESR and renal function tests. The imaging include echo, chest X-ray, and endoscopy. These are so as to see the condition of the heart, condition of the lungs, and the gut. The treatment is focused on suppressing the inflammation and the modified disease outcome. Dilating constricted blood vessels is also important because we want to increase the blood supply to prevent gangrene. So also the treatment can be grouped into two categories: non-pharmacological and pharmacological. On non-pharmacological part include the general advice like stopping smoking, avoiding vasoconstrictive drugs. We do not want to worsen the vasoconstriction. We want to improve blood supply or blood circulation. So we do not use decongestants and the amphetamines. Mhm. Decongestants are used, right? Mhm. We do not use decongestants and amphetamines. Physical therapy also, such as stretching exercises to prevent the progression of contractures. In pharmacological part, include topical therapy and systemic. Topical therapy includes tacrolimus, ointment, and potent corticosteroids, anti-inflammatories. Systemic therapy includes methotrexate, cyclophosphamide, and corticosteroids, but carefully. These others they act as immunomodulators. These are my references, and thank you for watching. Don't forget to subscribe. Have a nice day.